Nurse Digest session where we're going to look at the active script list and its functionality within the electronic prescription system. My name is Margaret Dempsey and I'm from APNA. Today I'm joined by Tram Doe, the Provider Adoption Lead at the Australian Digital Health Agency. Welcome, Tram. And I'm also delighted to welcome Marianne Schlosser. Marianne works as a primary healthcare nurse at a general practice in inner Melbourne and has worked there for 8 years. And she's also participating in APNA's Nurse Transformers project to spread the word about how digital technology can assist you in your everyday work. So welcome, Tram and Marianne.
Thanks.
Next slide. APNA would like to acknowledge the traditional custodians of the lands across which we meet today and pay respects to elders past, present and emerging. And I'm coming to you from Wathaurong country in Victoria today. Also a reminder to all registrants that they'll receive a link to today's recorded session via email, and it'll also be uploaded to APNA's website. So thanks for that. I'm going to pass you over to Tram and Marianne.
Great. Thank you for that, Margaret. And hello, everyone. Thank you for coming along to this session today. So it is the second of our 2 presentations on electronic prescriptions, where in the first one, we went through what electronic prescriptions are, how the tokens work, as well as how an organization can go about getting started to prescribe and dispense electronic prescriptions. And today, the focus of it will be on one of the newer functionalities, which is the active script list. So I will first highlight the different options that are available for individuals to manage their electronic prescriptions, then going into exactly what the active script list is, how an individual can go about registering to have an active script list, and what kind of consent is required to access someone's list. I'll take you through a short patient journey of using the active script list, and we'll also touch on some future functionalities that are in development and planned for the active script list as well. And as Margaret said, we do have Marianne with us here today as well. So towards the end, I'm looking forward to having a brief discussion on her experience with using electronic prescriptions and where she sees the active script list fitting into all of that. And then finally, taking any questions that you might have. So I'm actually just going to turn off my video so that there's no bandwidth issues, and then I'll come back at the end during our discussion and questions. So just as a bit of a recap, and in case you weren't able to make it to the first presentation, electronic prescriptions are the latest form of prescriptions. So they're an alternative to the paper scripts where everything is now electronic. And the existing workflow that is currently available nationally is with tokens. So if the individual has opted to receive an electronic prescription, then instead of receiving the paper copy, what they receive is a token that gets sent to them as either a text message or an email. And within this token, there's a QR code here, and that acts as a key to the electronic prescription. So when that token gets presented to the pharmacy, they can scan that QR code. And what this will do is it will unlock the electronic prescription and allow the prescription details to be downloaded into the pharmacy's dispensing software, and then they can then dispense and supply that medication. One thing to note with tokens is that it is 1 token per medication and 1 token per repeat of that medication as well. And so it works fine and is quite well suited for those one-off prescriptions, but you can imagine that it might be a little bit tricky to manage for individuals who are on a large number of medications, having to keep track of a large number of tokens as well then. So in terms of managing electronic prescriptions, there are a couple of different options. So the first and the most simple and straightforward is the individual can just directly manage the tokens that they receive as an SMS or an as an email through the respective inboxes. They can also elect or nominate to have a carer or an agent manager on their behalf. So the individual can forward the tokens onto their carer or the agent, or they can ask for the token to be sent directly to their carer or agent. There are also some mobile applications that are available. So, for example, there's MedAdvisor or My Pharmacy Link. And within these mobile apps, the individual will be able to store all of their tokens in that the app wallet, and so that just means that they can have all of their tokens in one central place, which will just make it easier for them to find and manage rather than having to scroll through all of their previous emails or text messages to find the relevant token. And there will also be some individuals who want their electronic prescriptions to be in a more consolidated list so they can see how many repeats have been dispensed, so they can manage their prescriptions more easily. And so in future, they will be able to register for an active script list. And I will go through this in more detail subsequently. So you might find that in future, patients will be using not just one, but a combination of these management options as well. So as I said earlier, tokens are work well for those one-off prescriptions, but for those patients who are on, say, 10, 15 medications, it could mean that they're managing up to 15 different tokens, and so that might become a little bit tricky. And this is then where the active script list will come in. So this is a newer functionality that is currently undergoing testing. So it's been rolled out to a number of test sites across the different states, but it's not quite widely available nationally just yet. It is to be rolled out quite soon in the next couple of months. But essentially, it's a token management solution. So the active script list is a list of all of the active electronic prescriptions and repeats that are available to be dispensed for this individual. So the pharmacies, they can actually directly go into an individual's active script list, access the electronic prescriptions through the list without the need for tokens. So the patients don't actually need to present the tokens anymore. So it removes the need for them to have to retain their tokens and keep track of them. So that does help to overcome issues with any lost tokens, for example, and it will help individuals to assist in managing their medicines as well as improving adherence as well. So, in terms of setting up an active script list, individuals will need to register for one. So, the first release of the active script list is quite pharmacy centric, where the registration for the active script list is done through an assisted process, and it's assisted registration through the pharmacies. So the individual will turn up to a pharmacy and ask to be registered for the active script list. And during the registration process, the pharmacy staff will need to complete the 100 points of ID check for this individual to register them. And in terms of the documents that are required, it does need, one of them does need to be a government issued photo ID. Another one does need to be a Medicare or DVA card, and then any other documents that will satisfy and make up the 100 points check. And then the individual will simply need to agree to the terms and conditions, and they will then be registered for an active script list. And so once they have an active script list, they can then nominate to have a carer or an agent, a manager on their behalf, and also collect medications for them on their behalf. Now, before any pharmacy is able to view the individual's active script list, they will need to request for consent, and they do that by sending an SMS. And I'll show you what that message looks like as well in one of the later slides. So when the individual signs up or registers for an active script list and agrees to the terms and conditions, they are acknowledging that by default, if they have any electronic prescriptions prescribed or any repeats generated, that this will go into their active script list by default. They do still have the choice to withhold or have some scripts not added to the active script list. And so within the conformant dispensing and prescribing software, there will be an option for prescribers and pharmacists to withhold these scripts from being added to the active script list if this is what the individual has indicated. So just in a little bit more detail of the overall process, the patient will attend their preferred pharmacy and request to be registered for the active script list. So the pharmacy staff will be able to help with the and perform the assisted registration. Once they're registered and they have the active script list, then when they attend their GP, and if they've elected to receive their prescription as an electronic prescription, then this will be automatically added to their active script list unless they've indicated otherwise. And so now that the script is in the active script list, it does mean that the patient doesn't need to receive the token as an SMS anymore, and they won't need to present that token with the QR code when they turn up to their pharmacy anymore. However, if they wish, they can still receive that token, but they don't. It just removes the need for them to have to. So then they will turn up to their pharmacy. If it's a new pharmacy and they're new to that pharmacy, they will need to validate their identity just as they would with any other prescription. And the pharmacy will be able to access their active script list if they've provided consent and dispense and supply the medication. And if there are any repeats on that prescription, then they can also be added to the active script list for this individual. So I have here a screenshot of what an active script list might look like for an individual. So you can see here the date that the script or the repeat was generated, the details of the medication, so the name, the strength, the quantity. You can also see the number of times it's been dispensed and the number of repeats. And there's also a type here. So you can see there's the tokens. So this token type is referring to those electronic prescriptions. There's also the paper types here. So there are actually one more form of prescriptions that will be visible within the active script list, and they are the ETP, or the electronic transfer of prescriptions. So what these are those computer generated paper prescriptions with the barcode at the bottom. So these ones, the details of the prescription is also available for viewing within the active script list. But you can see under the select column here that it's actually grayed out for the paper scripts. So it's not actually possible to select this script and dispense from the active script list, because with the ETPs, because it's the paper script, the legal entity is still the physical paper copy itself. So that is what needs to be presented to be dispensed. So the information is available for viewing, but you can't actually dispense off the active script list. And the other thing I wanted to point out here as well is that you'll notice that in terms of the details that you can see on this list, it doesn't have all the details. So, for example, the instructions are not there, and that's to discourage pharmacies from dispensing just off of the list what they see on this screen here, because that's not the legal entity. They do actually need to select the relevant medication and have that electronic prescription details downloaded into their dispensing software, because that's what the legal entity is. Now, before a pharmacy is able to access an individual's active script list, as I said, they do need to obtain consent. And so what they need to do is send a text message to the individual, similar to what's shown here. And then the individual will be able to reply with one of three options. So the first is they can reply with one yes, where they grant ongoing access to their active script list for this pharmacy. And this is the option that they'll most likely want to choose for their regular pharmacy. Um, The other option is 2, where they grant permission, but only for 1 day. So this is something that they might want to use for when they're traveling, if they're visiting a pharmacy that's not their regular. This will allow the pharmacy to access their active script list, but just for that day only. Or the third option is 3, no, where they refuse to grant the pharmacy access to their active script list. Now, if it is a new pharmacy, or if this person is new to that pharmacy, they will also need to confirm their identity. So the individual does need to ensure that they're able to verify themselves. As I said earlier, the active script list, the list itself, does not show the complete contents of the prescription, because that's just to help discourage the dispenser or the pharmacist from simply dispensing straight off of that list without actually downloading the prescription details into their dispensing software. And again, those ETP prescriptions, those paper scripts with the barcode, they're also visible in the active script list. So it just helps to give a better understanding of all of the medications that the individual's on. But it's not actually able to be dispensed without the paper prescriptions. And the only other thing I wanted to point out as well is that the active script list may not necessarily be, may not have records of every single prescription or medication that the individual is on, because remember that individuals can still be getting handwritten prescriptions, which won't go on to the active script list, or if they've requested for a script to not be added to their active script list, then obviously that one won't be available within the active script list either. So, as I said earlier, it is possible for patients to request that prescriptions not be uploaded to their active script list. Now, by default, electronic prescriptions will be added. So, it is the patient's responsibility to inform the prescriber or the dispenser if they wish for this prescription to be withheld from that active script list. And so, within the conformant software, there will be an option to withhold the script. And so I've got here a screenshot, an example of what it looks like in a Medical Director. So there's the active script list section in red there, where if the prescriber ticks that box, that will exclude the prescription from the active script list, so it won't go up. Now, this box is unchecked by default because, as I said, the default setting is for electronic prescriptions to go up. And so the individual does need to ensure that they do inform the prescriber or the pharmacist and make it known that they don't want their prescription to be added to the active script list. Okay, so let's now have a look at a short patient example of an individual using an active script list. So we've got Tracy here, who's on quite a number of medications, and she's started using electronic prescriptions. So she's got a few tokens, and she's got one paper prescription repeat remaining as well. So she quite likes tokens, or she quite likes electronic prescriptions, in that it's more convenient because she doesn't need to carry around the paper scripts anymore. But she does find it a little bit challenging to keep track of all of the different tokens on her phone. And so, what options are available to Tracy? So Tracy presents to her regular pharmacy and mentions this to her pharmacist, Ken, who suggests that she registers for an active script list. And that will mean that she doesn't need to worry about keeping track of different tokens and showing her tokens every time she visits the pharmacy. So Tracy agrees and has Ken help her with her registration. So she presents her 100 points of ID, and Ken sends her the SMS to accept the terms and conditions for registering for an active script list, and also confirming the historical upload of her active electronic prescriptions. And so what this will do is allow for her current electronic prescriptions to be included and available for dispensing in her active script list. Ken also sends her an SMS to request access to her active script list, and Tracy replies back with 1 to grant ongoing access because it is this is her regular pharmacy, and so going forward, Ken will or any other pharmacist will be able to go into Tracy's active script list and dispense directly from there without Tracy needing to bring in any tokens or anything like that. Now, Tracy now is away on holidays and she needs to have some of her medications filled. She's still got that 1 paper repeat left, but the rest of her medications are within her active script list. So she goes to a brand new pharmacy and checks with them whether or not they can access her active script list. So the pharmacy sends Tracy an SMS to request access or consent to access her script because this is the first time for them. And Tracy replies back with 2 where she grants them with access but just for 1 day. So now the pharmacy is able to go into her active script list and dispense the medications that Tracy needs. And in terms of the paper script, they will just use their existing workflows for dispensing the paper prescriptions. Now, just to note as well that in this scenario here, Tracy didn't use any tokens, but this is one of the scenarios where individuals are traveling, where it might be useful for them to have both an active script list and tokens. So in case they don't want the pharmacy, if that's a new pharmacy, being able to view every single medication that they're on the active script list, they can just present the tokens for the certain prescriptions that they wish to have dispensed. So all of what I've just covered is within the first release of the active script list, and that should be rolling out nationally in the next coming months. We are also working on additional functionalities for future releases. So in the first release, it will only be pharmacies that are able to register patients and view the active script list for individuals. In the subsequent releases, it is planned for general practices to be able to both register patients for and view the individuals' active script list. And in terms of patients, they'll be able to register at their GP or at their pharmacy. There are also mobile applications in development that will allow the individual to access and view all of the prescriptions on their active script list, and also have the option to order prescriptions that are on this list and manage the access of pharmacies that do have visibility of their active script list, as well as any care or agent details if they wish for someone to collect medications and manage their script on their behalf. There's also the functionality to manage the visibility of the prescription. So if there's any scripts that they wish to hide, they can also do that. So all currently in discussions and depending on and in development, depending on what the mobile app developers are able to do. So that essentially wraps up the presentation. If you do want any further information, there's a lot of resources and fact sheets on both the agency's website, so at digitalhealth.gov.au, and on the Department of Health. So if you click through to any of the hyperlinks there, you'll be able to find additional information. So I will just now take it over to Marianne and ask Marianne what your experience with electronic prescriptions are so far, and if you've had any limitations both with the practice or with patients with tokens.
Yeah, thanks. Yeah, so we've found that I'm interested that you say that they can only have 1 script per one medication per token, because one of the issues that we've had is that people have put 2 or 3 medications on the 1 token, and they have then had to adjust them at a later point, and it deletes all the other. So just say they had to change the dosage of one of those medications, it deletes all the others if they change anything within that. So that's probably one of the issues they're having.
Yeah.
Yeah, go on.
Yeah, no, so I would be interested in finding a bit more about the software, because as far as I'm concerned, it definitely is one token per prescription. So it is a unique QR code per supply of that medication.
No, we use best practice, and they can actually put a couple, 2 or 3 or medications on each token.
Yeah, maybe it's something we can take offline and discuss.
Yeah, no worries.
Offline.
So that was one of the issues that we've been having. But the other issue, the main issue, is that people lose their tokens, and
Yeah,
because
definitely.
especially when they go back for repeats, and it's like they had the first script was back in October, November, and of course that text message that they got with the script on it, a lot of people aren't very good at searching their phones, so they're like, oh, I can't find a doctor, and they just want, so they've got the repeat on their phone, but they can't scroll back far enough to find it. So having an active script list would be really helpful to people like that, because they can't find it on their phone. They know it's somewhere on their phone, but they just can't find it. So that would be great to have an active script list for those sort of people. So
Yeah, and you're exactly right, and that's one of the reasons behind the design of the active script list functionality.
Tram, I'm just going to interrupt there. And so with that question and discussion regarding the multiple medication on the one token, for everybody else listening, we will explore that further, and we'll actually address it at our next Nurse Digest in June. So we'll definitely address that through then, so that you'll have a definite answer about that. Do you have another question for Marianne? Because I've got a question from someone else. Yeah.
No, so my other question was, where do you see electronic the active script list fitting in, which Marianne has already covered?
How great is it for people with multiple medications, and
Yeah.
especially then on that holiday scenario? You don't actually have to think about taking all your scripts, and you can give somebody, access for the one day. It sounds
exactly.
great.
Yeah, it's not ongoing access if you don't want to.
I'll just read the question that asks about the 100-point check. Can you confirm whether the 100-point check is required for every new pharmacy where the consumer is visiting multiple pharmacies, like during the travels?
Okay. No, so the 100 points of ID is only for the initial registration of the active script list. In terms of confirming identity, it will be up to the pharmacy how they wish to verify the individual's identity. So it could be through a Medicare card, it could be through a license, up to the pharmacy. So the 100 points is only for that initial registration of the active script list.
Good, that's quite clear. And then each pharmacy has their own policy regarding asking for
and again,
ID.
it would only be the new pharmacies if you're a new patient to that pharmacy.
Like if the traveling scenario.
Yeah,
That makes
exactly.
sense.
Yes.
Yeah. Very good. And the other question is, so this active script list program it's in some trial stages now, and so it hasn't actually been rolled out nationally. Is there a timeline for that? But I'm really loving that the participants today are actually getting some information, early information and notification about this coming along.
So what the latest I've heard is in the next couple of months.
Okay. So
No specific date just yet, but that's what I hear, and it will be rolling out through the different states and territories as well.
And
So it might be a gradual.
Yeah, okay. But given that it's a national program, all that we're hearing about today would be the same. There wouldn't be differences across different states.
No, it should all be the same. So all of the prescribing softwares and the dispensing softwares that are able to view the active script list will need to meet the same conformance requirements. So they should all have the same functionality.
Okay, and I've got another question. Just confirming, for a repeat script via a token, in the case of if that token was issued a few months ago, you would have to search for the token and present that for scanning in order for that medication to be dispensed?
Yes, that's correct.
Yep, there you go. Answered that one.
Just a little tip with that one. tell your patients to just use their search function in their phone, and if they just search for script, it'll find it easily for them. So people don't think to actually search in their phone SMS messages. So yeah, if they just put in script, it'll come up for them.
Great tip.
It's a fantastic tip, and some of you'll notice there's a little poll just popped up on your screen if you'd be able to address that, how you've found today's session. Is there any other questions or comments? I don't have any other questions from the audience, but anything final that you'd like to say, Tram, before we finish up?
Just thank you for coming along. I hope that it was helpful. And I realize in the first release it is quite pharmacy centric, but good to just know what patients have available to them, and it will be quite similar when it does roll out to general practices as well.
Thank you for that. And I think it's great that for the attendees today, you actually have a recording of this. So watching your slides, and it's so clear and easy, and it'll be great. We will put the recording onto the APNA's website so that you'll be able to access that again as well and watch it. So I would like to thank you, Tram and Marianne, for joining us today's Nurse Digest session. And just to note that next month's Nurse Digest will be on the 3rd of June at the same time that you're tuning in now. And it's about utilising digital health tools in telehealth. So as I said, we will address that other question that you had as well. And we hope that you can join us then. And please take time to complete the evaluation form following this session. So thanks, Tram. Thanks, Marianne, for your input. And thanks, everyone, for joining us. Stay well and bye for now.
Thank you. Bye.